A new resource being called in to help Utah hospitals overwhelmed with COVID-19. Fox 13 News has learned the state is authorizing nursing students to be put to work to help Utah's beleaguered medical workers.
Ben Winslow is live on Utah's Capitol Hill with the story you will only see on Fox 13. Ben.
Nursing students are being drafted into the war on COVID-19. Utah's Department of Occupational and Professional Licensing is waiving some of the requirements to put them to work immediately.
I have not seen anything quite like this before.
As Utah's hospitals fill up with COVID-19 patients and healthcare workers are overwhelmed, the state is taking some new measures to try to provide some relief. Utah's Division of Occupational and Professional Licensing is creating a temporary license for nursing students. This email sent to all of the state's nursing colleges says it's to provide local hospitals and skilled nursing communities with a possible staffing option during the pandemic.
They're calling the title a nurse apprentice, and if they are interested in working as a nurse apprentice, which, as I understand it, will be taking care of patients who are not COVID positive, but patients who are hospitalized and need nursing care, so that it frees up the nurses in the hospital.
The state is coordinating with nursing schools and medical associations to create this temporary certification for students close to taking their final exams.
What they're actually doing is adding knowledgeable and fresh hands and legs to support the nursing staff who, of course, now we're running into the problems of we're having less, challenged staffing, having enough nurses. Many are out because they've tested COVID positive and they are quarantining, or they actually are sick and they're in isolation. They're exhausted.
Some of the nursing programs in Utah's colleges and universities believe it's a win-win for students. There are hundreds of nursing students close to graduating.
It's not like they're new to this. This is something they've been dealing with since March. So they have the skills to be good nurses, and they've also had the experience with COVID and the restrictions with COVID to be good and to be helpful.
It's also an opportunity to help students with their careers.
There's lots of other new stuff that's happened to this group with COVID. So this is kind of a positive new thing to happen for our students and our graduates.
Now, Dr. Close told us one important thing she really wanted to share with the public. It's important that you follow the public health guidelines, she says, because the less people get sick, the less they go to the hospital and the less nurses they need. So it's important to continue to follow the health guidelines. Live on the Hill, Ben Winslow, Fox 13 News, Utah.